Hello, everybody. How are you? I'm Dr. Jonas, and Dr. Sormani will be here. We are here to give a great presentation for you. Hello there. Let me see. Hello, Rajiv, Haged. How are you? Well, let's begin. First of all, thank you all for being here with us today. It's a real pleasure to welcome colleagues from Australia and different parts of the world who share the same interest in advancing clinic in implant rehabilitation and complex full arch cases. Today's sessions will be led by Dr. Sormani Queiroz, one of the Brazil leading oral and maxillofacial surgeon in advanced implantology. Over many years, Dr. Sormani has developed extensive experience in full arch rehabilitation, atrophic maxilla cases, pterygoides, zygomatic implants, and management of complex surgical situations and complications. What makes his work especially valuable is not only the technical aspect, but the clinical reasoning behind each decision and the practical experience accumulated through a very large number of real patient cases. For those who do know me yet, my name is Dr. Jonas Ferreira. I'm the founder of Brazil Surgery Hub, BRASH. And for the past years, I have been organizing international clinical training programs between Europe, Brazil, and Australia, always focused on practical education and real clinical exposure. This webinar is also connected to the upcoming Brisbane Hands-on Program taking place on June 13-14, where Dr. Sormani will be personally teaching and working closely with patients, participants in a small group environment focused on advanced full arch decision-making and surgical strategy. In addition to Brisbane, we are also organizing our clinical immersion program in Brazil, where participants have the opportunity to operate in real patients under supervision in advanced implantology, full arch rehabilitation, pterygoides, bone regeneration, and selected zygomatic cases. Our goals with this program is not simple to teach isolate techniques, but to help clinics gain confidence, improve decision-making, and accelerate their development in advanced implant rehabilitation. Thank you again for being here with us tonight. I welcome to Dr. Bashur. He is from Precision Dental Education. He will receive us in his clinic to the course in Brisbane. Thank you, Dr. Bashur. And now I would like to invite Dr. Sormani Queiroz to begin today's presentation.
Hello, everyone. Again, it's a pleasure to be here in our webinar series where we present some of the cases we did in our past courses. Most of the cases that I present here are from our courses with international doctors for all around the world. And this is an opportunity to share with you our experience and also to follow up the cases that we operated on that courses. It's always a pleasure, and I want to thank Jonas for inviting me for this moment, and all the attendees that are watching this webinar live or after in the recorded webinar. Thank you for Dr. Bashur. Again, it's a pleasure to have you here, and I'm really looking forward. I'm very excited to meet you in Australia in June, and I think it will be a great opportunity to share our knowledge about the zygomatic implants. For the one that doesn't know me, I am Dr. Sormani Queiroz, and I'm an oral and maxillofacial surgeon from Brazil. And in the past 10 years, I'm focused on the treatment of atrophic jaws, mainly on the aspect of zygomatic, transnasal, transsinus, and pterygoid implants. And I always like to share my views and my practice for the doctors around the world in webinars and in meetings and in my courses that I give in my clinic here in Fortaleza. This course I do with together with Jonas, uh, and both theoretical and practical training in live patients. Uh, that to me is the best way to really learn how to treat these cases. Uh, that ones that follow my work in these meetings, in the lectures, and in the internet, on the Instagram and WhatsApp, where I'm very active sharing my cases. Uh, all of you knows that I like to share not only the good cases, but I like to share some complications because I think we learn a lot with these complications. So today I again will show you a brand new case that I treated on Sunday, and it's a case of complications related to zygomatic implants. So I want to share you this case and show you how I I managed this case, and I hope this can help you if you have some similar case in the future. Because, like Brennemarx said, uh, the only surgeon that doesn't have uh, complications is the surgeon that doesn't do surgeries. So if you do surgeries, you will have some degree of complications. This is normal. This is statistical, and in any given moment, maybe you have to deal with these cases. And in fact, the people, the surgeons and the professors, they only show the good cases. They doesn't show the the, the bad cases. And I'm very honest with my audience. I like to talk about the the complications also that we have, because we don't just have the good cases. So it's important to know how to treat the bad cases also. So I will share my screen here.
Well, before we finish, I would also like to make a final invitation to those who are serious considering take the next step in advanced implant rehabilitation. The Brisbane Hands-on Program on June 13-14 is now entering the final stage of registration. We intentionally keep the group small to maintain close interaction, direct discussion with Dr. Sormani, and true hands-on learning environment. For colleagues who looking for an even deeper clinical experience, we also have a limited number of mentorship opportunities available, where participants can work directly with Dr. Sormani in real surgical cases, either in Brisbane or later in Brazil, depending on the program format. These mentorships are designed for clinicians who want to accelerate their transition into more advanced full arch rehabilitation, pterygoids, bone regeneration, and complex implant cases with direct supervision and guidance. At this moment, only a few places remain available, and we will be closing registration shortly. To make this opportunity even more accessible, I am also launching a special condition today for both the Brisbane program and mentorship pathways. For those interested in Brisbane course, the current price fee is 3,200 Australian dollars. However, for colleagues who decided to join today, we will exceptionally honor the previous registration price, phase price of our 2,010 and $100,000. If you would like to know more, simply click on the offer and speak with us privately on WhatsApp. It will be a pleasure to personally guide you and help determine the best pathway for your clinical goals. We would be very happy to welcome you in the program. Thank you again for being part of this evening with us.
Okay, I'm sorry about that. We had some technical issues here, but I'm back. Okay, can I start now?
Yes.
Can I start now? Okay. So this is a case that I want to share with you. This patient, we operated this patient 9 years ago in one of our international courses with some doctors from Europe. I think it was doctors from Portugal, Spain, and France. Uh, and this patient was operated in the course, and in fact, this patient after disappeared after we placed the provisional, the patient disappeared and just showed up last month with this situation, multiple infections in this area with signs and some symptoms of sinusitis, acute sinusitis, and oral communication, and also this facial fistula here over the zygomatic area, uh, that of course was causing some concerns of the patient. And after all this time, the last time I saw this patient, it was in, I think, 2017, or yeah, 2017, and he finally find me out last month, and asked me to a consultation to, of course, to evaluate his condition. So in the initial evaluation, facially, we can see this situation. And so he has these two areas where it was time to time draining some pus, uh, and that this was the main concern of this patient. And intraorally, remember the patient, the last time I saw him, it was in 2017. And so I removed the provisional, and we see this condition with this recession of the gingiva here, and this inflammation, all this inflammation. This is the situation of the provisional. This kind of provisional we did in the past. It's the prosthesis that the patient was wearing. We just converted it to a provisional. So we captured the prosthesis to the multi units. This case it was quad zygoma case. We used the implants from Norris. We can see the prosthesis when the patient arrived, and after the cleaning, we clean the prosthesis. Of course, this is not a good provisional. You have many issues that I will not discuss here, but it's not a good way to do a provisional. But we cleaned everything immediately, and we like to use this ointment, which is antiseptic to the both unities. And after the cleaning the prosthesis initially, and then after the cleaning the 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 implants, the mouth of the patient, so we can see the inflammation and the recession here, and we did the probe of these areas with the periodontal probe, and we could really see that we had a oroantral fistula in this area. This is the CT scan. Sorry about the quality because I took these pictures with the cell phone, but we can see that we did this quad zygoma, uh, and we also can see that in the right side we had this sinus opacification, and in this case the patient was with the right side sinusitis, acute sinusitis, and the left side there was no signs and symptoms, but the patient has some signs of chronic sinusitis also. And this is the picture immediately before the surgery. This picture was taken on Sunday. Again, I'm sorry about the quality of these images because I had to photograph with the cell phone. I didn't had how to make these pictures with a professional camera, but uh, I think that important is to have the images. So this is immediately before. So I choose to make the access for this area of the zygomatic of the zygoma uh, through extraoral access because I have the opportunity to correct aesthetically this area of the fistula. So I remove the fistula and access the implant because when I did the palpation in this area here, we could feel the tip of the implant. The tip of the implant, it was protruded beyond the cortical of the zygoma. So this was the cause of this fistula initially. So we have to approach this area and remove the protruded part of the implant because the implants were okay, and this is really I've been surprised because with all these problems it was a possibility to lose these implants, but the implants were okay, all also integrated, uh, but we had to remove the tip of this implant because this causes this kind of fistula. So this is the approach that we did. A fuse of skin that we remove to remove all the skin around the fistula, and then we will approximate. This incision is made based on uh, the cutaneous skin crazes to hide this the this healing as much as we can. And so this after we remove the skin and then approaching the subcutaneous tissue, and then we incise the periosteum, and you can see here this beautiful image of the zygomatic bone, the body of the zygomatic bone, and the tip of the implant. So you can see that this tip is really protruded beyond the cortical plate of external cortical plate of the zygoma, and you can see that we have a little bit of erosion of the bone here caused by inflammation. And after exposing the tip of the implant, we used a rounded drill to, like maxilla drill, to remove all that part of the tip that were protruding and to level at the same level of the cortical plate. So we cleaned everything. We removed the inflamed tissue, and we leveled this implant to the bone. And you can see here how it was before we did this procedure. And then intraorally, we made an access, a caudal loop access, and treated the sinus with removing all the compromised mucosa of the sinus and cleaning and removing all the secretion that we had inside the sinus. And we cleaned it very well. And then I placed a collagen membrane over the opening that we had in the sinus, and over it, we placed the bichafed pad that we pulled from the infratemporal area. So we covered it with the bichafed pad. So you have a 3-layer closure here. First the collagen membrane, then the buccal fat pad, and then the mucosa. So this is a very good way to have a really tight uh, closure of these fistulas. And then you can see here the closure of the skin. First, the internal layers. So first we place sutures on the muscles, then on the subcutaneous tissue, and then we go to the skin with the intradermic suture that is very static. And now we will wait to the healing process of the skin, and we hope that we will have a minimal scar tissue on this area, uh, and we expect a good outcome for this case. So this is, like I said, a brand new case. I did this surgery on Sunday with Dr. Quinteiroz from Mexico, that is here in my institute this week, following my cases and learning a little bit our philosophy of work, how we do with all the international doctors that uh, look for this kind of training here in Fortaleza. And it's a pleasure to share this with you. And if you have some question or any doubt and you want to ask me right now, I will be happy to respond all of you.